Hi everybody, this is Christine again. I'm going to be recording a video on phlebotomy or venipuncture. So basically what I'm going to do before I enter my patient's room, I'm going to verify what the order is and that it makes sense for my patient if I'm the nurse that's doing the blood draw. And what I'm also going to do is gather my supplies. So I want to make sure that I have gloves, which I can grab from the room, that I have some type of barrier to put underneath my patient's arm, that I have my tubes that I will collect my blood in, and then whatever type of needle and transfer device that is required, and then as well I'll need my gauze, and then also I need a tourniquet. So, I do not have my tourniquet. Here is my tourniquet. Alright, so once I have all of my supplies gathered, I can go ahead and go into my patient's room. So I knock on the door, do hand hygiene. I'm going to introduce myself to the patient. Hi, Colin. My name is Christine. We met earlier. Can you just, for me first, before we get talking about other stuff, just double identify yourself? By that I mean to just tell me your name and date of birth, please. So he says Colin Block, and he says his date of birth, and it matches his wristband. Perfect. So the reason that I am in here is because doctor has ordered for you to have a blood draw. He's ordered a CBC for you, which is a blood level that's going to tell us like what's going on with your hemoglobin, with your red blood cells, and things like that. Since you had your surgery yesterday, he said that you had a little bit of a blood loss, so we just want to make sure everything is at a stable level for you. So he says okay. All right, so another question that I have for you is, have you had blood drawn before? I'm kind of assuming you have since you've been here, but have you had blood drawn before? He says yes. Okay, so you're kind of familiar with it then. It's a pretty simple procedure. I'm just going to go in with a small needle. I'm going to draw the blood off that I need to get sent to the lab, and then I'm going to retract that needle. We'll put gauze over your arm, and then you're kind of good to go. So, before I get started, is there one arm that you prefer over the other, or have you had a mastectomy, a fistula, a graft, any kind of lymph surgery? And he says no. Okay, perfect. So is there an arm that you prefer? He says my left because I'm right-handed, and I say okay. So I just take a quick look at his arm. Oh, you've got a nice one here. Typically the site that we use for blood draws is the AC. So, all right, sounds good. I'm just going to raise your bed up here, Colin. I am going to go ahead and put your side rail down. Just get it out of my way so I have a little bit easier time getting at your arm. I'm going to put a chucks underneath your arm, and this is just to protect your linen so I don't get it dirty at all in case we find a good vein that wants to bleed a little more, okay? All right, so I've got my chucks down. I'm going to bring my stuff to the bedside here. And I'm going to show you a few different things while we do this. So, before I get started, depending on the place that you work, they may have different supplies for you to use. Meaning materials management, maybe whatever's cheaper, whatever's, more convenient at that time if they can get a bargain on it. So, there are different systems. This one right here, it includes the needle over here, as well as the vacutainer. So this would be the part where you put your tube in. So that's all in one system. There's another one where it's got the needle on one side and the stopper on the other. And you would twist this off. And then you would have to basically make the connection yourself. And you twist that on like there. And I don't know if you can tell in the video, but they look the same. So you may have to connect it yourself. There is another method where you can use a butterfly needle, and I think I'll just demonstrate this one. We'll use a butterfly needle, and then what you do is you connect a syringe on the end. We'll draw back the blood, and then I'll still have to hook it onto a blood transfer device, which is the same idea behind the other two. So I will show you that method, I think. So next, what I'm going to do is I'm going to go ahead and put on my tourniquet. We're going to put the tourniquet on about 3 to 4 inches above the site where I am going to go. And we'll put it on there tight, but not too tight, So you just want to make sure that you can still feel the pulse. Oops, sorry. Still feel the pulse afterwards, because if you put it on too tight, you won't feel the pulse, and that'll let you know that you need to loosen it. Next, what I'm going to do is grab my alcohol swabs. I threw those somewhere. And we're going to go ahead and clean the site for about 15 seconds. And we're going to go in a circular motion, working out at least about 2 inches. There we go. So we will let that dry completely. In the meantime, what I can do is I can get my materials ready. So like I said, I'm going to use the butterfly method to demonstrate. I'll put on my gloves. Open this up. Go ahead and pull that off. And then this one's a little bit different than the last one. So if some of these, this would be one that you could then twist this end on. I want to show you though the butterfly method with you attaching the syringe. So in this case, we'll pull that off, but you could still, like I said, twist one of these end caps on. So I'm gonna go ahead, make sure this stayed sterile, twist my syringe on, okay? All right, so I'm gonna bring over the items that I'm going to need just so they're closer to me. My tubes, if there was any additives in them, I would wanna go ahead and flick them on down to the bottom. As well as, like I said before, we call lab to make sure we draw the tubes that we need. There's also an order in which that you draw them, so you want to make sure you draw them in the correct order. So next, I am ready to go ahead and do my venipuncture. So I am going to go ahead and pull the skin taut about 1 to 2 inches below my insertion site. I'm going to insert my needle at about a 15 to 30 degree angle. And I'm going to keep an eye for a flash. And I've got my flash. I like to switch my hands and stabilize it there. Or depending on the angle that it went in, I may still use my dominant hand to hold on to it. It's totally dependent. Now, dependent on your mannequin, you will not always get blood return. But I can tell you I was in there because I felt the pop. So we'll pretend that we're getting blood, okay? I'm going to slowly pull back the plunger on the syringe so that I don't hemolyze the blood. And I'm going to pull back the amount that I need. All right. I've got the amount that I need, so I'm just going to set this aside. I'm going to go ahead and undo the tourniquet, switch hands again, grab my gauze, and go ahead and put it up there and hold pressure on it. This is your safety that you use on this. All that you need to do is you slide up that yellow and it goes over the needle, okay? I'm going to ask my patient to go ahead and help me hold pressure. We want to hold pressure 2 to 5 minutes. Obviously, if they're on any anticoagulants, you might have to hold pressure for longer. They can even raise their arm a little bit. All right, so Colin's going to help me hold pressure on that. I'm going to go ahead and disconnect. Make sure I put this somewhere where I keep an eye on it because that has the sharps on there. I need to put my connection, but while I'm doing that, I'm just kind of inverting my blood here. Again, maintaining sterility. Twist that on there. And then I'm going to insert my tubes in the appropriate order. And while it does that, I just wait for basically the vacuum to run out, because whatever needs to go in that tube, once it's pretty much like 2/3 full, it's getting close, but I want to just watch it and make sure it's done sucking the blood out, and then I know I can switch tubes. And then I'll just invert my tube again and put the next tube on and wait for it to pull it all back. You can see my syringe is pulling the air, but all right, then let's say those are the 2 tubes that I need. I've got all the blood that I need. I'm going to get rid of my equipment in the sharps container, so I will do that in just a minute. what I need to do with my tubes is, once again, before I label my tubes, I'm going to verify my patient, so ask them name and date of birth again, and then verify that those are the stickers that I place on my tubes. I'm going to initial date and time the tubes as well. Each of them gets their own label on them. And then I'm going to go ahead and double bag them, and then send them down to the lab with the requisition order form, you know, whatever form that the facility uses, so that they have that. So once I do that, I send that off. I'm going to go ahead and clean up my area. Like I said, put the sharps in the sharps container, making sure that he is done bleeding. Maybe I'll put a Band-Aid over it or tape, whatever it requires. I'm going to go ahead and clean up my area, put his side rail back up, and make sure he's in a comfortable position before I leave. And that is how you perform a